Hi, everyone. Thank you so much for tuning into my presentation. My study is looking at if OCPD symptoms and intolerance of uncertainty predict emotions. This study was conducted by myself and my mentors in the psychology department at WVU as a requirement for my capstone and Excel project. To repeat, for my project, I was interested in looking at intolerance of uncertainty and OCPD. So to begin, intolerance of uncertainty is described as the intense discomfort or the inability to handle uncertain situations and is a transdiagnostic factor across multiple forms of psychopathology. Heightened levels of intolerance of uncertainty have been found in individuals with OCPD and have been found to significantly predict OCPD traits. Specifically, individuals with OCPD will experience emotional difficulties such as anger and anxiety that impact their level of functioning and distress. And intolerance of uncertainty has been shown to mediate improvement in anger and anxiety. So my specific research aim is to examine the relationship between intolerance of uncertainty and then specifically the experienced emotions in OCPD. In order to do this, I created 5 hypothetical scenarios that were modeled after the trait factors that make up OCPD. Each scenario is based on a specific situation that may make someone with OCPD feel anxious or angry. Following each hypothetical scenarios, there are a series of PANA scales to measure anger and anxiety. So in all, we used the following measures. We used the POPS, DAS-21, IUS-12, the 5 hypothetical scenarios, then the PANA scales that followed each scenario. Our goal was to obtain 72 participants to get the data that we needed. Each participant is 18 years or older and was recruited from Amazon's MTurk. For the procedure, each participant would complete the POPS, DAS-21, and IUS-12 in that order. Following completion of those questionnaires, in addition to demographics, participants will read and imagine themselves in the 5 hypothetical scenarios and then respond to the questionnaires that follow. So our projected results, we are currently in the process of collecting data, but after we obtain all the data that we need, we are going to conduct a series of 3 hierarchical regressions that will be conducted to determine the extent to which intolerance of uncertainty predicts experienced emotions above and beyond what OCPD predicts. We're expecting to find that OCPD will predict measured emotions. Specifically, intolerance of uncertainty will predict these emotions beyond what OCPD predicts. So we're expecting to see that those with greater OCPD symptom severity will have higher intolerance of uncertainty and experience more anger and anxiety in response to the hypothetical scenarios, while those with lesser OCPD symptom severity will have lower intolerance of uncertainty and experience less anger and anxiety in response to the hypothetical scenarios. So based off of our hypotheses and our expected results, we are hoping to find a relationship between intolerance of uncertainty, OCPD, and experienced emotions. This study will hopefully expand the knowledge within the field on this relationship and may provide answers that would assist in developing a gold standard treatment, which currently does not exist for OCPD. This also would expand upon previous literature, open up new research ideas, and add to the understanding of OCPD, which is a significantly understudied disorder. However, there are some limitations to this study. One is that we have an unselected sample. So the people that are going to be a part of our obtained sample, it may not have a wide range of OCPD symptom severity. So for example, we may not have a lot of people with severe OCPD symptoms. The hypothetical scenarios for this study are new and have never been tested before, so there's no validity or reliability for these. They were created specifically for the study. Additionally, the sample may be characterized as having higher levels of anxiety, depression, and stress. That is why we included the DAS-21 to assess this, but this may impact our findings. But overall, the study is currently in progress. We're really excited to see where our results take us. And thank you so much for tuning in. I really appreciate it. Have a wonderful rest of your day.